Today, I'm going to give you a brief update on the pandemic. As I mentioned on Friday, despite trends moving in the right direction, we remain in a very serious situation. COVID-19 continues to affect too many people as we continue to mourn all of those lives that have been lost. Cases have continued to decline over the last 4 weeks. An average of 119,900 new cases were reported between January 31st and February 6th. That's a drop of nearly 20% from the prior week, but still dramatically higher than the last summer's peak. We must continue to drive these cases down. New COVID-19 hospital admissions also continue to decline. An average of 9,977 admissions per day were reported between January 30th and February 5th, a decline of nearly 17% from the week prior. This is promising, but hospitalizations also remain incredibly high. Over 83,000 Americans are hospitalized right now with COVID-19, much higher than the summer and fall. Today, we are reporting that COVID-19 deaths increased 2.4% to an average of 3,221 deaths per day from January 31st to February 6th. As I mentioned on Friday, sometimes delays in reporting can lead to fluctuations in the data. This is the case for the average number of deaths reported today, which includes a delayed report of 1,570 confirmed deaths from one state. These deaths were reported last week, but actually had occurred over the prior several months. We may continue to see the variation in daily deaths for different reasons, including reporting delays. We are continuing to watch these data closely, and although hospital admissions and cases are consistently dropping, I'm asking everyone to please keep your guard up. The continued proliferation of variants remains of great concern and is a threat that could reverse the recent positive trends we are seeing. As of February 7th, 699 variant cases have been confirmed across 34 states, with 690 of these cases being the B117 variant, the variant first reported in the UK. Please continue to wear a mask and stay 6 feet apart from people you don't live with. Avoid travels, crowds, and poorly ventilated spaces, and get vaccinated when it's available to you. I recognize that the pandemic has taken an enormous toll on all of us, but if we all work together and take these prevention steps, we can finally turn the tide. Thank you. I look forward to your questions, and I will now turn things over to Dr. Fauci. Dr. Fauci?
Thank you very much, Dr. Walensky. I'd like to address briefly 2 issues that have come up for discussion over the last several days. And one is the question of, given the fact that there is a greater demand than there is supply, should we be putting all of our effort into getting the first dose into people with less emphasis on the second dose? Now, the reason for that I have explained in the past, because the science has shown in both of the vaccines that we have currently available, the Moderna and the Pfizer, the strong data indicates that a prime boost gives a maximum response of 94 to 95% efficacy. But the question has arisen, why not study in detail whether or not you can get away with a single dose? It is not an unreasonable thing to suggest a study. The only issue is that the practicality of that really makes that a situation that I don't think is able to be done for the following reason. If you look at the number of people that would be required in a study to answer that question again, 1 versus 2, with the currently available vaccines, the time it took to get information on the phase 3 and the number of people, that study, with all due respect, would take several months to get a meaningful answer. At that time, the amount of vaccine that would be available would almost be making that question somewhat of a moot point. So then let's ask ourselves the question is, what do we know about 1 dose versus 2 dose? And the data, I think, are important to present. We know from the original studies that following a single dose of either the Moderna or the Pfizer, you had a response that gave you a neutralizing antibody above the threshold of protection. And finally, one thing I want to emphasize, as we know and we've heard, and it's true, that the projection is that the 117 lineage would likely become dominant in the United States by the end of March. Please remember that the efficacy of the currently utilized vaccines, the true mRNA, are quite a things that we can do is A, make sure we adhere to the public health measures that Dr. Walensky just mentioned, and B, get as many people vaccinated as quickly as we possibly can. That's the best defense against the evolution of variants. I'll stop there and back to you, Andy.
Thank you, Doctor. All right, why don't we go to questions?
So I have two questions. One about the variants. I know that before we've gone over them and we've said that the latest numbers have been a couple hundred cases, but we also know that, we're pretty behind on sequencing and working to ramp that up. So what number do we think is actually out there, and how much higher do you think it could be than the numbers that we've actually identified positively so far? And then my second question is about a comment that Transportation Secretary Pete Buttigieg made, saying that they are considering requiring testing for domestic flights. What would the benefits of that be, given we know just how much transmission there is in the US right now and the data on how much it spreads on flights when everyone is wearing a mask, or the lack of, I guess? Would there be benefits to that actually happening?
So maybe first, why don't I turn to Dr. Walensky to talk about our ongoing efforts at surveillance and increasing our knowledge, and maybe a little bit about what the current state of knowledge we think might be with regard to these variances. Doctor?
Great, thank you. And thank you for the question. What I can say is we're learning more about the number of variants, and the number of variants that you're hearing increase is very much, at least in part, due to the fact that we're doing a lot more sequencing of these variants. So over the last 3 weeks or so, we've increased our sequencing about tenfold. So as we look more, we're certainly anticipate we might find more. Over the next several weeks, we are planning actually to not only have collaboration with the state labs from every state, so we can make sure we're sampling from every state, but also with collaborations from commercial labs as well as academic labs. So we anticipate that we're probably going to be sequencing up to 3 or 4 more than we're already sequencing. And I think once we have more sequencing that's happening, we'll have a better idea as to how many variants there are and what proportion are out there.
Can you give us your assessment of some of the states that have begun to relax their protocols? For example, Iowa, among those who has reversed some of the indoor requirements in terms of masking and public social distancing. And also, given that a number of schools all across the country are discussing how they are going to reopen, there is an urgency to that matter. I know that you said that the CDC's guidelines for school reopenings would be coming soon. When can people expect to see that? And have you gotten to a place where you can give us any indication about whether you think teachers should be vaccinated before schools reopen?
Great. Well, I think both of those are probably going ahead for you, Dr. Walensky, but let's do them. First one is your comment on states or local jurisdictions that may be relaxing some of the public health standards that the CDC has been recommending.
So maybe I'll just start and say, given that we're still at over 100,000 cases a day, I would discourage any such activity. And I would say that we are still in the first 100 days where we wanted certainly everybody masked for the first 100 days. I think we have yet to control this pandemic. We still have this emerging threat of variants, and I would just simply discourage any of those activities. We really need to keep all of the mitigation measures at play here if we're really going to get control of this pandemic. And in that regard, as we move towards and think about schools, what we know mostly about schools in terms of the data are that most infections come into the schools through the community. The data from schools suggests that there's very little transmission that is happening within the schools, especially when there's masking and distancing occurring. And that when there are transmissions in the schools, it is because they've been brought in from the community and because there are breaches in masking and distancing. So if we want to get our schools open and our schools open safely and well, the best way to do that is to decrease the community spread. So I would say we need to keep up our social distancing and our masking and all of our other mitigation measures. Our CDC guidance on school reopening will be coming in the days ahead. And I look forward to thinking through those with everybody.